So this one in particular?
That's a good one.
Yeah.
I think this one will go over pretty well.
No,
Because that's so real, you know? That's so real.
It's pretty real.
It's like very attractive.
On November 11th, Alex woke up with a burning forehead and terrible stomach pains.
All over the place.
After checking his temperature, he called a cab and went straight to the hospital.
In a cab.
Doctor! We have a patient with Ebola.
Are you sure that it's not just a common flu, nurse?
See for yourself.
He just got back from Africa?
10 days ago. He started showing symptoms today.
Bring him to me. Let me just put on my gloves.
Alex has a fever of about 102.2, terrible stomach pains, and is vomiting.
Ebola. So what are your symptoms?
Well, you know, I just have a little fever, stomach pain, itchiness. I'm just afraid. You ought to stop.
Give him an aspirin. Check on his temperature every 25 minutes, okay? Faster, nurse! I'm not paying you to sit around!
Yes, doctor.
Doctor, you're making me feel uncomfortable.
Well, what do you expect? I'm a doctor without borders.
Alex's fever went down to 100. Dr. Andrew and Nurse Nico continued to use symptomatic treatment, which is where they cured symptoms as they appeared.
You know, I've taken like 6 Advil. I don't think it's working.
Why take 6 Advil when you could take just one? Aleve. Oh my god. Okay. Aleve is not recommended for patients with heart disorders. Symptoms of Aleve include
You still have a pretty high fever, Alex. And oh no! Oh no! Oh no! I'm hemorrhaging everywhere! And this is my favorite shirt! His condition is worsening. There's vomit all over the floor. His eyes are red. Oh my! And the blood! The blood.
we need to treat this. Stat.
What's happening to me?
You see, son, Ebola infects your blood cells and is making them do nothing other than replicate the Ebola virus. This way, they won't be able to fulfill their duties as cells. Eventually, this causes hemorrhagic fever. This means that it will cause you to leak everywhere, whatever those substances may be.
Alex is suffering from hemorrhage fever, which is when blood escapes from ruptured blood vessels.
We need to stop the bleeding. Where is it coming from?
Everywhere.
Everywhere?
Dr. Andrew was able to slow down Alex's hemorrhage fever with blood transfusions and IVs.
There's some sort of medicine I can take to get rid of all this?
No.
What doctor is trying to say is no. There's no vaccine or medication that can cure Ebola. And although experimental medications are being developed, we are going to stick with symptomatic treatment.
I'm gonna keep you attached to these IVs. This will maintain your oxygen status as well as your blood pressure.
Action.
But what about the box?
Alex is referring to quarantine, which is where Ebola patients are kept in isolation because they have been exposed to infections or contagious diseases.
Unfortunately, it's too late for quarantine. This is meant to happen when you arrived home from Africa, but since it didn't, symptomatic treatment is our only option. Girl. You're cured!
Cured! Doctor, I feel like $1 million.
He did!
Thanks a lot. That was really cool.
Thus, our story ends. Alex went on to provide shelter for plenty of lambs. Doctor went on to discover the cure to Ebola. Turns out, the cure was just Minute Maid pomegranate juice. And I went on to lead a vigorous nightlife.